earlier this week, former President Joe Biden announced that he has been diagnosed with an advanced stage of prostate cancer, which has metastasized to the bone. Well, joining us on what such diagnoses mean and what new treatments are out there is Dr. Eric Wallen, chairman of MUSC's Department of Urology and Assistant Director of Community Clinical Engagement at MUSC Hollings Cancer Center. Glad to have you with us. Thanks for being here.
Great to be here.
So this sounds pretty serious, the fact that it has metastasized to the bone. He's 82 years old. So what does a prognosis like this, can he potentially clear the cancer?
We can't clear it or cure it, but we can manage it really well for years.
Okay.
It used to be that we only can manage it for a few years, but now we're keeping patients with all the various tools that we have now to treat for 5 or 10 years when they have metastatic prostate cancer.
And when we say a cancer has metastasized, what does that mean exactly?
Well, with any cancer, if it's metastatic, it means it has spread from the organ that it originated in. So prostate, for whatever reason, has a predilection to go to the bone. It also spreads to lymph nodes and other organs, but it's unusual in that it spreads to bones.
Once it has entered the bones, how serious is that?
It's serious. They can be very painful, or they can be not painful at all. We have better tools now to diagnose when it has spread to the bones. There's a scan called a PSMA PET scan that helps us identify when that has happened.
I'm surprised, though, that he wasn't checked for it, though, within the last 11 or so years. So how often should one get checked, and especially at that age? He was also the President of the United States, so you'd think he'd get checked for everything.
Yeah. When we are doing screening for prostate cancer, which means checking when people don't have any symptoms whatsoever, the value of screening really ends at the age of 70, because generally prostate cancer is very slow. So as people age, there's less and less benefit to screening them for something that is not going to kill them.
Oh, gosh.
So we do screening early for men, usually around the age of 50, and American Cancer Society recommends earlier than that for people at higher risk, Black or family history in their 40s. Stopping at the age of 70 is appropriate, and it appears that that's what had happened.
It would make sense to me that there would be testing throughout the rest of your life if you're healthy otherwise. Why let that be the thing that takes you out, you know? So do you think that there's going to be any changes in the method?
I think many men and many doctors do feel more comfortable continuing screening in the most healthy men, the men who we still think are going to live for 10 or 15 or even more years, which is the case for the healthiest men in their 70s and 80s.
So within that 20-year window, 50 to 70 years old, how often should men get tested for prostate cancer?
Usually annually, although if they get tested and the risk is very low based on the test results, we can do it every other year or even every 5 years for people who have the very lowest risk.
And it sounds like it's relatively non-invasive for the most part.
The testing, you mean?
Yes, the testing.
So testing is usually a blood test that's called PSA. That has been around for about 30 years now. There are newer tests that are supposed to be and do give us better information, more specificity about prostate cancer. PSA is a tricky test, and it can be abnormal for a variety of reasons that don't include prostate cancer.
Okay. What kind of treatments are out there, just if there's anything new that can maybe eradicate some of these other metastatic cancers?
For metastatic cancer, there are several treatments that can help prolong life significantly. The first step in almost every case is something called hormone therapy or androgen deprivation therapy that blocks a man's testosterone and can control the disease for 2 to 5 years, usually an average of about 2.5. Beyond that, there are things that we can do to the bone metastases to stop them from growing or stop them from hurting. We have chemotherapy, we have immunotherapy, and we have combinations thereof that are in our clinical trials here at Hollings.
Okay, wonderful. So there are trials going on right now?
Yes, for every step of the way, yes.
Very good, wonderful. Well, thank you so much, Dr. Wallen, for sharing with us. We appreciate this really invaluable information.
My pleasure.
Thank
Good
you.
to be here.
We'll be back after this.